vaccine breakthrough, developing the disease and requiring hospitalization, are hypertension, diabetes, and cardiac disease. So these comorbidities, as I've listed, are just a reminder to those that are vaccinated and require boosting that they go to get boosted so that they can receive full protection from Omicron and any subsequent variants of COVID-19 that may arrive here, and continue to practice those things that protect as well, to give the extra layer of protection, social distancing, and masking. If you move to the next slide, please. This slide shows the protection that is afforded us when we wear masks. A new MMWR study shows that wearing a mask indoors helps protect against COVID-19, compared with those who reported not wearing a mask covering. People who reported always wearing one in indoor public settings were less likely to test positive for COVID-19. Respirators such as N95s, KN95s were most protective. So wearing a mask in indoor public settings helps protect us and our loved ones and those around us from COVID-19. Those who wore the N95 or KN95 received an 88% risk reduction in developing COVID. A surgical mask provides 66% reduction in risk, and cloth masks protect us and reduce our risk by 56%. So masking continues to prove to be one of our staples in protection. And if you go to the next slide, please. These are some images from our current dashboard. The left-hand side shows our 7-day moving average, and the colored bars depict our risk stages. We are still in stage 5. We are, however, moving towards stage 4, and that will likely happen in the next 10 days or so. We still have high community transmission rates, so we will take our time in making that move into relaxation of our current mitigation strategies. Vaccine will continue to be the pivotal message of all of our messaging that we do. It needs to come not only from our public information officers, it needs to come from within this community. We need to ask ourselves to take the time to go get those boosters and vaccine shots. And each and every one of us can be a messenger to friends, family, and colleagues to encourage them to go out and get vaccinated and boosted. The protection that we will get from vaccines will help us move to a new stage in this pandemic response. It'll help us make some changes in our mitigation strategies to allow for relaxation. But for now, we need to continue to do what we're doing with masking. And if you look on the right-hand side, you will see that the increase in masking that's occurred since the beginning of the Omicron surge has correlated with the decline in cases that we've been seeing. So if we can protect ourselves, we will be able, with vaccine and boosting, and particularly when the under 5 vaccination is approved and available, and get the rest of our vulnerable populations protected, we will be able to move forward and see the light at the end of this tunnel. Next slide, please. Masks and all of the mitigation strategies that we've used for the protection and mitigation of COVID-19, which is an aerosolized viral entity, have also impacted our flu cases in our area. There has been an increase in the positivity rate of the flu in our area. However, the positivity rate is calculated by the number of positive tests over the number of tests done, and there were less tests done. So we have a positivity rate that's been affected by the numbers of tests more so than the numbers of cases, which is depicted on the graph on the right-hand side. The predominant type of flu that's circulating in our community at this point is influenza A. The CDC reports that there's been a really good uptake of flu vaccine in the country and in our area. This message has been put out to ask everyone to not only get their COVID shot, but their flu vaccinations as well. And this vaccine for flu, as well as washing hands, socially distancing, and use of masks, have continued to help us keep the numbers of flu cases down in our area. Next slide, please. As we look at Omicron's impact on our schools, we had some tough times. We've had some days, some weeks where we've had over 5,000 cases reported in our ISDs. These numbers are continuing to decline. The recent cold weather event has kept some children at home, so that's also helped to keep our numbers down. But in all, the efforts of vaccination and masking and social distancing, hand washing, and all of the measures that have been done by our schools and businesses and long-term care facilities have all afforded us this new period of time when case numbers are declining, and that again is good news. The next slide, please. To summarize our hospital situation on this slide, we're seeing that admissions have gone down week over week. Our admissions have been predominant in all age groups. There are pediatric cases in hospital now, 13. During this last period, we had one admission to ICU of a child who had comorbidities. All of the pediatric patients in hospital at this time are unvaccinated, so it's important that we understand that our vaccines are safe. There have been over 200 million doses of pediatric vaccine delivered in this country to date. On the 15th of February, the FDA will be convening to hear the data that's been collected by Pfizer regarding use of vaccine in those under age 5. And we're hopeful that this will be approved and subsequently approved, and we'll receive guidance from the CDC ACIP committee. These numbers will continue, I'm hopeful, to go down. We've had no reports of the BA.2 variant to date in our community. However, even if we do find that 3 weeks ago we submitted a sample, because it does take 3 weeks for the results to come back, of BA.2 in our community, BA.2 being the sublineage of Omicron that is reported to spread more quickly. I think that we will find that we will still have this decline in case numbers because our community is doing what it needs to protect itself and to get the spread of COVID-19 under control. The situation with getting our vaccination rates up will continue to be an ongoing struggle that really does require a community effort. Our booster coverage right now is 31% of those who are fully vaccinated. So we have a long ways to go with getting the rest of our population vaccinated with the booster vaccine. There's some confusion about fully vaccinated versus up to date, and I'd just like to take a minute to talk about that. A fully vaccinated individual is someone who's received the primary series of vaccines, so 2 doses of mRNA or 1 dose of the J&J vaccine. A booster is a shot that's received subsequent to those primary series boosters, vaccinations. So in the case of the mRNA, Pfizer or Moderna, a booster is required at 5 months after the mRNA, Moderna, or Pfizer. A booster is recommended after 2 months for the J&J vaccination series, primary series. This coverage will be critical and crucial to our moving forward, as I said, to this new stage in our pandemic and moving out of pandemic to endemic. So it is my hope that the community will again start to get out, go get your vaccines, become up to date, which is the terminology used for anything after the primary series, anything that's been advised after the primary series and receipt of that. It's going to be important that we do that so that we can continue to enjoy lower numbers of cases, return to a new normal, and to allow us to be in situations where masking is not required because we are surrounded by a protected community who's been vaccinated. And with that, I'll pass it on to Director Stirrup.
Thank you, Dr. Walks. And I'm going to quickly give an operations update to allow time for our other partners to brief out and then for commissioners and council to have questions. So here on this first slide, you see our overall response for operations and services for the month of January. A decrease in the number of COVID shots that were given. And so we really want to flip that around. And conversely, there's been an increase for the month for testing with a total of 21,000 COVID-19 tests administered. And so I think this is information that folks know well. Here are all our options for testing. And again, we want our community to get tested if they were exposed, get tested if they feel sick. When in doubt, please get tested. And so for the last week, we did over just 610 tests. And as you are aware, our operations were altered due to the cold weather. But we're back in business at the George Morales Dove Springs Rec, at the Expo. We continue to offer mobile and in-home testing as well as facility testing. So when we turn and take a look at vaccinations by week in Travis County, last week, over 7,000 vaccines were provided in the county. We remain at 72% fully vaccinated for those 5 and older, and 83% of the eligible population has received at least 1 dose. When we look at our winter weather operations, even though we weren't at our public sites, we did support at the embarkation point, providing testing as well as vaccines for our guests who showed up seeking shelter. And you can see for all of the activations thus far, we've given out a total of 108 vaccines, and some of those were flu. And we've also provided a total of, that total looks wrong. So I'm gonna have to do some quick math. 3, 12, 14, 18 COVID tests. When we look at the distribution for vaccine in Travis County by age, we can see that we're starting to see some numbers in the 5 to 11 population for folks who are immune compromised and are receiving that 3rd shot. We're also seeing the numbers go up for the 12 to 15 population for booster and third dose. When we look at APH's work with regards to pediatric vaccine, we continue to be pretty close to the distribution by race and ethnicity for our community. And then when you look at our total vaccine distribution by county, and we're trying to work with the data because we knew there were some questions last week. So this slide shows a breakdown of the Travis County Census population estimates by race and ethnicity. And then the other pie chart includes the fully vaccinated population by race and ethnicity. And so the fully vaccinated chart demonstrates that the other category is overrepresented compared to the other category provided in the Travis County Census estimate. Additionally, the unknown category accounts for 4% of the total fully vaccinated population. The other and unknown category account for a total of 27% or 235,412 individuals within the overall fully vaccinated population. When we look at Travis County residents with up-to-date vaccines, and thank you, Dr. Walks, for making that distinction clear, we see our pie chart again, and within that fully vaccinated Pac-Man, green Pac-Man, we see that just under 41% have completed the primary series only, with our booster rate being at 31%. So again, as Dr. Walk said, we really want to encourage our community to go out and get vaxxed and get boosted. All but one, when we look at our first dose vaccinated population by zip code, all but one zip code has achieved that 70% mark, and that's that 78705. And then when we look at our second dose fully vaccinated population, 2 new zip codes have moved into the green, 78723 and 78758. And that means that 70% or more of that population have received a second dose. 3 zip codes have moved into the yellow from the blue, and those are 78753, 78752, and 78742. So this is just demonstrative of all of the good work that our partners within APH, the county, and community are doing to get our folks protected. Our vaccine operations are the same for this week. We're at Delco, Pfluger Hall, Sims, and Southeast Branch Library. You can visit us at www.austintexas.gov to get the specifics for each location. We do have mobile ops scheduled for this week, and those are listed there in the middle block. And again, going back to the caller's comments, those mobile operations are strategically identified to address those communities that need additional support and resources to get vaccinated. And to her point, as we see, there's a call for testing operations to be open for people to go to work. So we know that there are some folks in our community that don't have the luxury to even take care of their basic health needs. And so that incentive that we offer allows people to miss work and still be somewhat whole, still have money for groceries or whatever their immediate basic needs might be. We continue to ask the community to help share our 3 core messages: mask up, get up to date with your vaccines, and get tested. We continue our communication efforts with our media Q&As. We continue to support activities with different press releases. We're going to release a press release on COVID-19 and chronic illness today. And we continue to make sure that our social media platforms have information in 4 different languages: English, Spanish, Simplified Chinese, and Vietnamese. We continue our community outreach. To date, 30,000 individuals were reached through staff efforts. For this week, we'll be at the locations listed there on your screen. And this last slide is just a reminder of the tireless efforts of APH staff. We're out there in the cold at the Southeast Library delivering those vaccines because we know it's important. And I will turn it over to the judge. Thank you for your time this morning.
Thanks, Director Stirrup. I'll turn it over to Chuck Brotherton for a report from him and Constable Morales.
Good morning, Judge and Commissioners, Mayor and Council. I'm Chuck Brotherton, the County Executive for Emergency Services. I appreciate y'all taking time to get a brief update from Constable George Morales this morning, as well as from Todd Hamilton with Central Texas Allied Health Institute. At this time, I'll turn it over to Constable Morales.
Good morning, Commissioners, Council members, Judge, and Mayor. The goal of the mobile vaccine team is to continue to offer barrier-free vaccines, outreach, and education within our communities, our vulnerable zip codes, and our hard-to-reach populations. This last week, obviously, we were slowed down with the winter freeze, so we did about 178 shots, bringing our total for the month for the year at 8,566 total combined shots. Again, the highly effective zip codes, kudos to everyone that helped bring the 5.8 and the 5.3 and the 2.4 up for vaccinations. Great job to APH and our mobile vaccine collaborative. Again, we're going to be working with the schools, AISD, DVISD, Manor ISD, Harmony Schools, Idea Schools, Wayside, and again, this week, Mexican Consulate. We will continue at our static locations at JD's, Grocery Market, La Mexicana, again, Expo, and El Rancho and La Finca. This week, again, repeating Travis County Expo, African American Youth Harvest, Del Valley Opportunity Center, Daly Middle School, and Montopolis Recreation Center. I'll turn that back over to Chuck at this time.
Thank you, Constable. Mr. Hamilton, if you would give the court an update.
Yes, sir. Thank you, Chuck. Good morning, everyone. To echo the words of the Constable and Dr. Walks, Central Texas Allied Health Institute suffered a slowdown in vaccinations due to the freeze, where we only delivered 25 vaccination shots. We have in turn, starting today, started to go out into the community to remind people that we are here and we are willing to serve you as far as the vaccinations. We continue to follow the orders of the Constable and the County Coalition and their direction. Back to you, Chuck.
Thank you, Todd. Judge, Mayor, Commissioners, and Council members, I'm going to share my screen quickly and just show our viewing audience where they can find information regarding our vaccine operations on the Travis County public-facing website, traviscountytx.gov. Click in the upper left to get COVID-19 information, and that takes anyone to our daily schedule for strike team and vaccination clinics day by day. You can see Tuesday, February 8th, the hours of operation and the locations. Click on any one of these. Here's Pfluger Hall today starting at 2 p.m. Types of vaccines available, ages, location, hours of operation, etc. So very convenient, and we do our very best to keep this calendar current. One final note, we are continuing, as you heard Constable Morales say, we will continue drive-through vaccine operations this weekend at the Travis County Expo Center on Decker Lane, Saturday and Sunday. We are looking ahead later this month, by the following weekend, February 19 and 20. We will be relocating our drive-through vaccine operations from Expo to the county tax office / Constable Precinct 4 offices, which are located at 4011 McKinney Falls Parkway. And we will begin operations at that location again on Saturday, February 19th. We will be working with our public information team to make sure that that is publicized. Everybody will be made aware of that change. But again, this weekend we will be at Expo as we have been for the last several months. This time I will pause and turn it back to you, Judge, for questions.
Thanks, Constable Morales. I guess it comes full circle back to where it all started.
Yes, it does, Judge.
All right. Well, thanks again for doing that, and thanks for taking up the mantle of giving out vaccines at your office again at the Precinct 4 location. So today, since Council has a hard stop at 10:15, they are going to ask questions first today. We will ask questions second. We still also have to end by 10:30, so Council, please do limit yourselves to one question each if possible. Mayor, I'll pass it over to you.
Colleagues, as you've heard, we're trying to move through this more quickly, I guess, than normal today. But we're going to start with District 10 and then work our way up to District 1. Then I'll go. So Mayor Pro Tem, you want to start us off?
Thank you. I think we might have started with me last time, but I don't have any questions. Thank you for everyone for your work.
Okay, Councilmember Tovo?
Oh, no.
I hear the chipmunk again.
Oh, no.
Kathy, should we come back to you? Let's do that, if tech folks could work with Kathy. Councilmember Ellis?
Thank you, Mayor. I would like a little more information if there's any expectation of subsequent booster shots, since a lot of folks have already gotten theirs. Is there any understanding that in the next year that we might need another booster shot?
On a CDC call yesterday, they said that they're discussing some additional vaccines and some changes to the scheduling of vaccinations, but there's more to come on that. We don't have the definitive answers on that yet.
Thank you.
Okay, thank you. Councilmember Poole?
Yeah, thanks. And I just saw a note from Kathy saying that Councilmember Tova was simply trying to say thank you to everyone. Came out as the chipmunk, and I add my thank yous as well. And I'm going to pack up and head to our strategic planning session. Thanks to all.
Sounds good, thank you. Councilmember Kelly? Is she with us? How about Councilmember Kitchen?
Thank you. I did have a question. I do think it bears repeating just to make sure we're all clear, Dr. Walks, that we are seeing a reduction and we're headed towards stage 4, if I got that correct. We're not yet out of the woods, though, in terms of the surge. Is that appropriate to say? So that continuing ask and those recommendations around that are important. Could you clarify that for us?
Yes, we need to move the needle literally and get more people boosted and continue what we're doing so those case numbers go down. Our community transmission rate yesterday was still high. Anything above 100 is high, and we were in the 400s. So it's important for us to continue to do what we need to get the numbers down, but we're doing that. And with the continued efforts in this community to get their boosters, wear a mask in indoor public spaces, we will get there. And then we can all have that collective discussion about what our new normal is.
Thank you.
Thank you. Councilmember Vela?
No questions for me, Mayor.
Okay. Councilmember Renteria?
I just want to thank all the foot workers out there working really hard, and just want to say thank you. And you guys are doing an outstanding job. So that's all I have to say, man.
Okay, thank you. I don't think that Councilmember Fuentes is with us. Councilmember Harper Madison, is she with us? Okay. Let me add my thanks as well. It's good to see the numbers coming down. What's really encouraging, I think, Dr. Walks, are the slides that you had in your presentation that showed what the community response was with masking. The community looks like numbers went up on masking, getting up to that service indicating almost an 80% level in our community at the time that we needed it most. There's the discussion that you see on social media occasionally about whether or not masking actually helps. So I appreciate the slide that you put in this time And I want to just point that out, that while you know, the best mask is highly effective, even a cloth mask is 50% effective, and that's a huge relative number. I'm looking at the numbers where we are right now, and we're just over 60 right now as we look at a 50 mark, and 4 days ago we were at 80. So it looks like that number is going down pretty precipitously. I know that we don't necessarily move just when we get below 50, but that's kind of the indicator to give that a serious look, and for the policymakers to engage in that conversation. But you know, for a community, I think that is tired, but doing the right thing, and watching what's happening around the country with respect to rules and regulations. We're looking at the same kind of numbers for us locally, and we'll appreciate the momentum that we have, and we're headed in the right direction. And we'll wait to be hearing when people can move to stage 4 activity. Anxious to be looking for South by Southwest coming up. Looks like the numbers are coming down, and my understanding is that they're working pretty diligently with you on protocols to make that event one that's safe. Is that correct, Dr. Walks and Director Stirrup?
Yes. Yes, they've presented a solid plan, and things are looking good.
Great. I point that out because in past years at this point, we probably had, you know, a couple hundred events kind of geared into that. And this year it seems to be lagging a little bit. I think people waiting for that kind of indication. So I think people should know that as the numbers continue to go down, it becomes even that much more something that can be done in a safe and productive way. So I'm looking forward to that event happening and people participating. With that, Judge, we'll turn it over to you, colleagues. We need to be for the SD23 meeting. I think that's at 11 a.m. start. I think people are going to start moving over there about 10:30. So we'll see you over there. I'm going to, at this point, Judge, adjourn the City Council portion of this joint meeting. Obviously, colleagues can stay on or continue to listen if they want to. But here at 9:47, I'm going to adjourn our portion so that people can move if they need to. Thank you, Judge.
Boy, I've been watching you, and I know